Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department. As requested by one of our news agencies, the spelling of my name is Monica, last name Hendrickson, and again, Public Health Administrator for Peoria City County Health Department. Begin today's briefing by going over the to-date totals for our cases of COVID-19 for Peoria, Tazewell, and Woodford County. In regards to probable and confirmed cases, the Tri-County sits at 29,559. Again, that's 29,559 cases. That's an increase of 1,482 over the past week. That brings the to-date total for Peoria County at 14,628, Tazewell at 11,742, and Woodford at 3,189. We're saddened to report an additional death in Tazewell County, female in the 70s. That brings our to-date total for the Tri-County at 467, which is an increase of 32 deaths from the previous week. That's 9 additional deaths over the past week for Peoria County to bring the total to 210. 20 additional deaths in Tazewell County to bring the number to 201, and 3 additional deaths in Woodford County over the past week to bring it to 56. Overall, just under 90% of our population is considered recovered, with 9% at home and isolating, and 0.2% hospitalized. In regards to our 7-day and 14-day averages for the Tri-County, we've seen our 14-day average stay steady. Today we are adding, our 14-day average was 225 new cases each day for the Tri-County compared to our 14-day last week, which was 223, so very consistent. But we did see a decrease in our 7-day average, going from 238 cases a week ago to 212. So the good news is we are trending in the right direction. And that can also be seen in our hospital systems. OSF St. Francis Medical Center and Unity Point Health, Proctor, Methodist, and Pekin are reporting 25 ICU beds in use for COVID-19 and a total of 74 non-ICU beds in use. They are saddened to report 3 deaths in the past 24 hours. In regards to 7-day averages for our hospital systems, the ICU capacity remains stable. Today we sit at 31 versus this time last week we were at 30. And we are happy to say that our non-ICU bed average has gone down by 10 beds. We were at 79 last week, and today we sit at 69. So again, we are trending in the right direction, which means that Peoria County, along with Tazewell, Woodford, as well as the rest of Region 2, are really in a good position to move towards Tier 2 tomorrow. We understand that more mitigation metrics will be released. And just to reiterate what that means, for a region to move to, down from Tier 3 to Tier 2, you need to have less than 12% test positivity of the 7-day rolling average for 3 consecutive days, and have greater than 20% of your ICU capacity and your medical surge capacity over 3 consecutive days, and seeing a decline in the number of COVID-19 patients in the hospital. Right now, in terms of our Region 2, we are sitting at 8.5% in terms of our rolling average for test positivity, and overall above that 20% capacity for our ICU and our med surge. So we're very excited to know that the work that we've been doing during the holiday season, it was a difficult holiday season, but because we took those steps, we've seen the effects of it by trending in the right direction to start getting through this. I did want to really focus today on vaccinations. There's a lot of excitement from when the governor spoke earlier this week as to where we are in terms of moving forward. We anticipate that 1B, or Phase 1B, will be opening next week. This will include individuals 65 and older, as well as frontline essential workers. And I do want to preface, when we talk about frontline essential workers, we are talking about a broad category, but the key to recognize about this group is that they are at a higher risk of exposure due to their inability to perform their work duties remotely and because of their proximity to other coworkers or to the public. So that's why these frontline essential workers are in 1B, because of that job duties. With that, I want to, along with my peers, make it clear what the public should expect as we move into 1B. 1B is going to be one of our largest phases. To give you perspective, between the Tri-County alone, the total number of individuals 65 and older is 64,399. Again, that's 64,399. In Peoria County alone, that is 31,620. Moreover, the weekly allocation that the local health departments are receiving continues to vary as we start getting more vaccine and the process becomes more stabilized. But it can range anywhere from 5,000 to 7,000 doses per week. And that is not just for local health departments, but that also includes the healthcare community as well, because we distribute our allocation to them. So while the local health departments and our partner agencies are able to vaccinate more people, we don't have enough vaccine yet. So we are currently working with our partner agencies, which includes our hospital systems, our federally qualified health centers, as well as our EMS providers, on a plan and process to dispense as quickly as possible to a large number of residents as we can. In addition, it's not that we just have limited vaccine, but there's only a few qualified entities that are allowed to have the vaccine. And that's because of the approval process through the federal government to have the vaccine. So while we appreciate a lot of our independent practices or small entities willing to step forward to vaccinate or obtain vaccine, again, there's a federal process for you to actually get that vaccine, and we can only share our vaccine with those entities that have gone through that federal process. So again, just want to make sure that when we get more vaccine, we are going to be pushing it out as fast as possible, but patience is what we're asking our community right now. And we really are extremely happy that we've gotten so many residents that are eager to get vaccinated. Again, patience is the key. In recent days, individuals, specifically those 65 and older, have been calling the local health departments, calling their providers, calling 211, all these entities, leaving messages and what have you. Again, very excited that there's such a huge interest in the vaccine. But we are also asking that when we move forward, not to necessarily start calling the health departments, but we will be pushing out information directly to you in a variety of ways. So again, if you can, because of the volume of calls, we are asking for individuals not to call or email their local health departments at this time, or to leave messages just because of the large volume that we're receiving. And we understand your interest, and we will push out vaccine information to you as soon as possible. Likewise, please do not show up to the vaccine clinic locations. You need to have an appointment to be there. It creates a flow issue. We want to make sure that we are able to address those people with appointments that meet the 1A and 1B criteria. So again, we're asking you not to just show up to local health departments or to the vaccine clinics. We do ask that if you are a staff or a resident of a long-term care facility, please work with that entity to get your vaccine. That vaccine is allocated before it is allocated to local health departments, so it will be a faster way for you to be receiving your vaccinations. Likewise, please monitor the local health department website, our Facebook page, and local media. They have been great partners in making sure messages is getting clearly pushed out and information is available. Again, we are really, and I speak on behalf of the Tri-County, we are overwhelmed by the positive response our community has about getting vaccinated, but we just want to make sure that we are able to go through this process, and I hope you understand the limitations we are currently working with, and as soon as we get more vaccine, we will be pushing it out as fast as possible. One of the things we do want to focus on is that we've gotten questions recently about who should be getting vaccine and what it means. And so to kind of talk more about the importance of the vaccination, we have Dr. Sater from UPH, the Chief Medical Officer, to talk specifically about comorbidities and the impact they have.
Thank you, Monica. My name is Samer Sader, S-A-M-E-R, S-A-D-E-R, and I'm the Chief Medical Officer at Unity Point Health Peoria Region. As we all know, and Monica just described, the number of people who perish from COVID still quite significant. It has increased in our area since October through now, is significantly higher than the previous months. And the people who are actually at risk are people who are older, people who have comorbid conditions, and that's just a fancy word to say people who have illnesses that put them at risk. And those illnesses include, number one, diabetes, number two, COPD or chronic lung disease, number three, anything that affects your immune system, and that category can be very large. That includes people who are transplant patients, people with chronic illnesses like dialysis, people with cancer who may be receiving chemotherapy, people with autoimmune disorders such as Crohn's, ulcerative colitis, lupus, rheumatoid arthritis. That group of people have a lower immune system. They tend to do worse. People with heart disease also tend to do worse. And if you start to think about your own family and how many of them have those risk factors or are on that age group, you start to do the math, and the numbers that Monica described are very easy to imagine. If that group gets vaccinated, that would relieve the hospitals significantly. Well, what does that mean? It means that the number of beds taken up by COVID patients, the number of ICUs, and the amount of staff, because believe it or not, the amount of staff is the most critical one. Our nurses, our doctors, our aides, pharmacists, techs that take care of the patients also get infected. And if they are not available to care for people or we're stretched to the max, then other patients go without care. And that's what we're trying to prevent. So if you're 65 and older, if you have one of those comorbid conditions or chronic illnesses, the health systems and the health department will contact you. What we're really asking today is, everybody's anxious. I can tell you I had a clinic today, saw about 25 patients, 30 patients. Most of them want to get the vaccine. My patients have chronic kidney disease or are dialysis, and they're really excited. They want to say, who do I call? The answer is, we will call you. Just give us a little bit of time. We know who is taking care of who, and the patients that don't have a physician, we will release a plan for you. But if you really want to make a difference for our community, if you're in one of those high-risk groups that are not in nursing homes, because like Monica said, those are getting vaccinated through a different program, get your vaccine when we get a hold of you. Don't crash the vaccine sites because it doesn't work that way, and we really want to avoid crowds or end up in the news like other states. We want to do it in an orderly fashion where we can monitor the patients and do it effectively. Thank you. Happy to take questions, or back to Monica.
I guess maybe start back, what I would say 1A numbers as far as how many doses you've received and how many of those have been administered.
So the question was regarding for 1A, how many doses we've received and how many have been administered. I don't have our weekly numbers. I imagine that we did another 3,000 this week for our first dose vaccine. I really highly recommend, if you haven't seen it, the Illinois Department of Public Health has a great dashboard on terms of the total numbers of vaccine dispensed, as well as what we would consider complete coverage. That means they got their second dose as well. And so this week has been a little bit on the transition side, because this is actually the week where our hospital systems that received the Pfizer allocation, that first dose there in December, this was the week for them to get their second dose. So again, there's a lot of operational changes that happen that we need to get a second dose in at the same time that we're administering first doses. But I think to date, between our healthcare systems and our local health departments, we've done over 7,000 individuals.
What percentage is that of the people who need to be vaccinated, the people who are in 1A?
So I don't have the exact numbers for our 1A, and that's, again, a fluid number because of the group that encompasses both paid and unpaid. But what we've measured in terms of how we know that we feel comfortable moving into 1B is that we've opened it up to a lot of entities for 1A, and keep it open for them. And we've seen that the uptake and the interest has dwindled, and to the point where we feel that there was enough, I would say, access for them. And so when we saw the slower uptake in terms of appointment times, some of the days our appointments were being completely booked within an hour. then we realized that we had the capacity to move on to 1B. But again, we wanted to make sure we were aligned with the full state's plan.
So is the amount of vaccine you're going to be receiving for 1B going to be similar to the amount you're getting for 1A in terms of how fast you can get this group, fully vaccinated?
So the question is about the value of number of vaccines that we're getting. We expect to actually start seeing more and more vaccine come into the market just because of manufacturing reasons alone. But I would echo that it's going to vary, and it's going to keep varying. As you are fully well aware, the Biden administration, the incoming Biden administration, has mentioned that they want to release all of the vaccine at once. And so we are preparing to surge up if we need to. I think that's one of the conversations we've had with our hospital systems and our FQHC is that today we are expecting anywhere from 5,000 to 7,000. If next week, if we are at 15 to 20, can our system handle it? And the good news about our region is that, yes, we can handle that uptake in vaccine.
So you mentioned there were around 65,000 people, 65 or older in the Tri-County area alone, but that 1B also includes other groups. I mean, how big is that 1B group in this area total?
From our approximate numbers, and our approximate numbers is really us communicating with those 1B entities and asking them roughly how many. We have anywhere about another 40,000 individuals that would be 1B. Now, again, not everyone wants to get the vaccine immediately when it's offered to them, so we expect about a 50% uptake. But overall, I think it's going to be close to 70,000 people that we're going to be trying to vaccinate in the short term at minimum.
Monica, do you have a sense of how many nursing homes, long-term care facilities have been vaccinated?
The question is about how many nursing homes or long-term care facilities have been vaccinated. We've requested that information from the Illinois Department of Public Health, and we're hoping to get it as well. They're getting it from a federal partner. But just from us cold calling our long-term care facilities, a majority of them actually already got their first doses in. Yeah.
Any thoughts or plans on a mass vaccination site like the Civic Center, Renaissance Coliseum, or another facility to try to speed up the process?
So the question is, any interest in a large site to help speed up the process? And I think that's going to be really dependent on how much vaccine we get. Right now, the limited amount of vaccine does not necessarily have us needing that type of space or entity. But when we move to subsequent phases, whether it's phase 2 or phase 3, then we would be looking at maybe novel approaches to doing a mass vaccination of that time period. But again, right now, our biggest factor is how much vaccine we get on hand each week.
Can you talk in general about kind of a plan so that, like the video we all saw about people standing for miles and miles, so that it doesn't happen here, or is it too any kind of a plan?
So the question is about a lot of we've seen in different states, specifically large lines of people waiting to get vaccinated, and so I think what's really strong that Peoria has done in our region here, as well as I think the state's plan, is that we want to make sure it's a phased approach, that we're communicating it as well. And as Dr. Sater mentioned, we will be reaching out to you guys. And the biggest thing to recognize is that we are balancing a lot of operational things that go at the same time. Not only is it just getting a single dose, but also getting prepared to do a second dose 28 days later. Likewise, the limited amount of vaccine that we have, we want to make sure that we're doing it equitably in our community. And so what our biggest, I think our biggest asset in this plan is communication. We're in constant communication with our healthcare systems, and the health department recognizes that we are not going to do this alone. We're going to do it with a lot of partner agencies. And as this more and more vaccine comes into our community, we're going to bring them online so that hopefully we get to a point in time where customer choice can be easily done. They can go where they want to go to get their vaccine.
So as the 1A vaccination wave started, you had mentioned something about community advocates who are out there that kind of help dispel some skepticism and hesitancy, especially among communities of color. So now we're going to see a great expansion of availability for people. So what's the role going to be there to address that now that's going to be available to so many more people?
So the question is about community hesitation. I think one of the two things you're going to see is a local effort. One is a media campaign about individuals and why they are getting vaccinated. But likewise, the health department is working with University of Illinois College of Medicine to actually survey different communities to understand what the hesitancy is. We can talk about it in a very academic way, but it can come down to something simple as there's 2 different brands. There's a 3rd brand coming to the market, Johnson & Johnson. Which one's the best? So we have to be able to digest that information and be able to approach them. And so the health department is working with UI Comp and surveying the community to understand what those needs are and make sure we're pushing out information appropriately. Likewise, the state is actually doing a statewide campaign where they've reached out to communities and identified champions to help support and really work in the grassroots efforts to have those one-on-one communications about what vaccination is, how it works, and why it's important. So hopefully, these groups come online and we see this information and people are listening into our own press briefings, they're able to get comfortable with that information and be able to share. I'll say there is a individual that recently got vaccinated because of their position in the 1A and 1B grouping, and it was one of the great advocates that we had. So it's always good to make sure that if you are interested in getting vaccinated, you get vaccinated, then share that story with others. A lot of times we can talk about it, but peer-to-peer communication is going to be strong.
Monica, in terms of the language that you guys are saying to wait for us to call you, your doctor will call you and make an appointment for you, isn't that going to leave out a lot of people? I mean, that's going to leave out people with, serious chronic conditions, or that's going to include people with serious chronic conditions. But what if you're just 65? Or what if what if you have a chronic condition, but, you don't go to the doctor that much and you're not on their list? How are you going to be included in that?
So we are working through that communication tool. Part of it is similar to what we saw in contact tracing world as well. When we work with individuals that have been identified, we've had community partners step up to fill in that gap. A great example is testing. We have testing sites that are run by the state, by our federally qualified health centers, even brought by our ambulatory AMT has been doing testing. But there's also testing sites through your primary care provider's office as well. So what we're making sure is that there's going to be lots of touch points for people to get vaccinated. Luckily, our hospital systems have looked through their own data, their own electronic health record system, as well as our federally qualified health centers, and realized that that 65 and older group, based on a touch point, at least one minimum touch point in the hospital system, covers a large majority of them. So they'll be working through that network as well. But we understand there's going to be a few that fall through the gap, but that's where the health department and other community entities will be going out and doing very much specific interventions in those targeted areas.
But if you're saying, don't call us, we'll call you, and then you never get the call, what should you do?
If you never get the call, and again, when we say never get the call, it's not that you're going to get a call tomorrow, the day we release it. It's in the next few weeks. Then you would want to contact the health department, but we'll be giving you a specific number to reach out to.
At what point will you do that?
Again, we'll be hoping to finalize those plans here over the weekend.
We're hearing from family members asking about once their loved ones in long-term health care get their second dose, what kind of time frame is there, or has it been determined when they can safely go back and see them?
So the question is, once our long-term care facilities have received their full vaccine doses and have built up that full immunity, when can loved ones come and visit them? That's really going to be guidance that's coming out from CMS, and we're all waiting for that to come out. But I know it's been a very hard year for our long-term care facilities and their residents and families, and so we just want to make sure that when it does come forward, that it's done safely in a way that doesn't put others in risk.
Do you have a sense when that happens, if the people who go to visit people, they might be younger, they haven't been allowed to get vaccinated yet, will the visitors have to be vaccinated as well?
I'm not sure about what the specific details are, and I think we're all looking forward to see when the CMS would say about that.
With 1B rollout starting next week, like you said, do you have an estimation or a rough timeline when 1C could or would start?
That's going to be really difficult because similar to right now, we as a community might be looking to move to 1B, but there are still parts of the state that are still working through 1A. And so, again, we want to make sure that we are at a pace that is done equitably across the full state. And so 1C, might be coming sometime in April or March, April, May. It really varies depending on how much vaccine we get in the next few weeks from manufacturing.
In terms of the Tier 2 mitigations that we're going into, so we aren't being allowed to go back into Tier 1, which is where we were before we went into Tier 3. Is that correct?
So based on our data, which is that you need to be below 8% to move into Tier 1, we are sitting right now at below 12%, which moves us from Tier 3 to Tier 2.
Okay, and then Tier 2, so there's no indoor dining. What changes with Tier 2 from Tier 3?
We are hoping to make sure that the guidance that's going to be pushed out, I believe, tomorrow on the DCEO website as well as the IDPH website will make sure that some of the specific things that we saw in terms of gyms and other entities are going back to the Tier 2. Even the gatherings is no longer just households, it's just the size limit. But the biggest thing that I think everyone is wondering about is restaurants and bars, and still in Tier 2, bars and restaurants will be closed.
Those those are numbers. Do either of you have any concerns about going to 2, and will we just then hop? You're nodding your head. Do you have any concerns about, that
So-
it's better, but are we just going to go right back?
So I would tell you that we've seen a slight uptick in the number of patients coming through the hospital compared with 2 weeks ago. And I view that as the kind of the Christmas uptick is nowhere near what was happening at the end of October or November. So we're really hopeful that things went pretty well through the Christmas holiday. And after New Year's, once we hit the 3-week mark, we'll probably have a good idea. I can tell you that we only test symptomatic patients. When we test symptomatic patients, we're still testing about 28%, give or take a couple of percentage points, positive. So that's a little bit concerning for us that our positive rate hasn't really dropped for symptomatic patients. So that's something that we're keeping an eye on. And it just tells us that people did pretty well in the holidays. It could have been a lot worse from Christmas. I